does not give keys or secrets of genuine individual healthcare. Social health is totally neglected. I would say in India, social health is a neglected orphan. ഒരു അവഗണിക്കപ്പെട്ട അനാഥനാണ് പബ്ലിക് ഹെൽത്തിന് ഇന്ത്യ, സോഷ്യൽ ഹെൽത്തിന് ഇന്ത്യ. Because we don't give any importance to it. അത് തുടക്കത്തിലെ വേണം പറയാം. Do we have safe drinking water? ഇത്രയും നേരം വെള്ളത്തിനെ പറ്റി പറഞ്ഞു. Do we have safe drinking water? India is the only country where the tap water is not safe for drinking. It's not a priority here. It's not a priority here. So our priority is how to change to improve healthcare. Knowledge about individual health and minute aspects is not enough. It has to be translated into activities aimed at public health, social health, so that individuals remain healthy. That's what we have to focus on. Individual health is, we can say in one word, we are what we eat. But are we eating only through mouth? What we eat through eyes. That means what we see, read, what we listen, what we hear, what we smell, what we breathe also. Or through the nose we are smelling also. Not only breathing air. And what we touch. So the inputs are coming through all these, and these are the things. I talked about drinking water. Unless and until all of us get safe drinking water, we talk all about but where is the water? It's not. It should be safe drinking water through pipes. The tap water should be safe for drinking. Unless and until we have safe drinking water distributed through the taps, we cannot say we have safe drinking water. Now the Prime Minister has announced that clean water is safe. Clean means but it may not be safe for drinking. It has to be safe drinking water. Most important is air that we breathe. Ventilation every day I have to, when I go to take rounds, I need to tell the sister or patient to bystander to open the windows. Windows are also AC AC off windows are patient. They are not even aware of what they need to breathe every day. Most important is the air to breathe. So for that there should be enough ventilation. If it is not an AC, cross ventilation should be there. Outside you need to have plants and trees to make available enough oxygen. You need to do exercise if you need to get enough oxygen. And if you are overweight, your chest wall is thick, it cannot inflate. You will not get enough oxygen. That's why Talimark oxygen is. So unless and weight gain from the doctor, if you are overweight, you get several diseases. One of them only is hypertension, diabetes, fatty liver, cholesterol, diabetes. Then you get all the consequences of these diseases are stroke, heart attack. And polycythemia, blood in the category. This is weight gain. Weight gain is oxygen. Your chest wall cannot expand. The balloon can easily expand. But needs more force to expand. So if you are overweight, there will be a condition called chronic hypoventilation. And that can lead to chronic hypoxia, polycythemia, not besides all other diseases which are due to weight gain. Oxygen individuals parks, public places, then only we can do exercise. The exercise we should not be translated to health clubs and yoga centers. Centralized exercise should be decentralized. You should be doing exercise without being even aware of it. Suppose you have footpaths and cycle paths, naturally we will be engaging in cycling, walking. If you have public places, you will be going there, and that will give enough exercise. So you should have places for exercise so that we will be doing it without being even aware of it. Centralized exercise programs is not going to work. It is for the lazy, rich people. The yoga centers. I'm totally against promoting yoga as an exercise method. It's for the lazy, rich people. And the mild exercise only, stretching movements only. If it's an exercise, it has to make you breathless and sweat. That alone is exercise. For that, we need public places, parks, cycle paths, footpaths. ഇതൊന്നും പറ്റാത്തവർക്ക് വേണ്ടിയിട്ട് മുട്ടിന് വേദനയുള്ളവർക്കാണ് യോഗ സെന്റേഴ്സ്. It's not bad, but it's not enough. So let us promote public exercise programs. I'm talking about individual health, social health relation. If you want to be healthy, you need to have several social reforms. വെള്ളത്തിന്റെ കാര്യം ഡോക്ടർ രാജു has beautifully said, but how much water? I would say on average you need to take at least 2.5 liters of water per day. കൂടുതൽ സ്വെറ്റ് ചെയ്യുമ്പോൾ കൂടുതൽ വേണം, but never less than 2 liters. You need to produce at least 1.5 liters of water urine. 1.5 ലിറ്ററെങ്കിലും മൂത്രം പോകണം. That needs at least 2 liters and minimum 2 to 2.5 liters. That need to be increased when you are exercising. You need more water. Naturally, that water should be safe for drinking. And we need to preserve the water bodies, and safe drinking water should be there to every household. Food. Next is food intake. I said what we eat is what we are. Like, first is air, second is water, third is food. How many of us know what to eat, what not to eat? That is the biggest problem. We eat whatever is tasty and often to full stomach. What to eat is not known to many. How much to eat, how often to eat, and everyone should have access to balanced diet. So free ration കൊടുത്തോണ്ട് എല്ലാവർക്കും ഫുഡ് കിട്ടും. It has to be balanced diet. Balanced diet alone can give you health. So we need to educate everyone on what to eat. And then we must empower them to access all these necessary items. So we need education has to happen at several levels, starting from primary school onwards, and schools and colleges. You have to educate about what to eat, what not to eat, how much to eat. And then we need to empower them with large amounts to different areas. This is a balanced diet concept which I have been promoting for the last almost 2 decades. This is one plate that you have to eat. One plate means it has to be maximum should be vegetables. Second, most important is water. At least 1 glass of water should be there when you eat. It can be taken before, during, or after meal, and there is no harm. Nothing like that. You can drink whenever you want, but 1 glass should be included in one-time meal. Most important is vegetables, component wise, and that will give all the magnesium. Even if something is missing in the water, you get magnesium from the adequately taken vegetables, and fruits should be there every time we eat. So in that case, probably even RO water may not be a problem when you take enough vegetables and fruits each time when you eat. But it's good to have mineralized water. Then you need to have a source of protein. The protein for vegetarians is curd, or mushroom can be a source of protein, and pulses, dal, these are proteins for vegetarians. But non-vegetarians have egg, fish, meat also, and all the seafoods. You don't have to take 2 sources of protein at a time, because if you take excess protein, there can be a problem of uric acid, elevated uric acid. And the least important is the food item that we are talking about. South Indian ration is the area of that's the least important. That is like petrol. You need it only when you exercise. You don't need it when you are taking rest. People are filling their stomach with this carbohydrate only. In fact, literally we are eating poison whenever you are eating excess carbohydrate. I would say that excess carbohydrate is the most dangerous poison ever discovered. should eat according to your requirement, never more than that. But unfortunately, wherever we eat, we are getting only carbohydrates. Without protein, without vegetables, without fruits, and even water is less. So remember this as a plate at each meal, not in sequence, simultaneously. So കഴിക്കുന്നുണ്ടെന്ന് വെച്ചാൽ ഞാൻ രാവിലെ വെജിറ്റബിൾ കഴിക്കും, ഉച്ചയ്ക്ക് കടല കഴിക്കും, രാത്രി ഫ്രൂട്ട്സ് കഴിക്കും. It should not work. It has to be there simultaneously. And how much to eat? This is to avoid overeating and weight gain and problems due to that. I told you that if you're overweight, you will not get enough oxygen. So you should be eating only half the capacity of stomach. That includes 1 glass of water. The major portion has to come from vegetables, some fruits. Fruits can be maybe approximately the size of an orange. അത്രയെങ്കിലും ഫ്രൂട്ട്സ് ഓരോ നേരം കഴിക്കണം. ഫ്രൂട്ട്സ് പറഞ്ഞാൽ ഇറ്റ്സ് നോട്ട് ഡ്രൈ ഫ്രൂട്ട്സ്. അൺഫോർച്ചുനേറ്റ്ലി നമ്മുടെ ഫ്രൂട്ട്സ് പറഞ്ഞാൽ ഉടനെ പോയിട്ട് they buy these dates, omega dates are mixed. That is a glorified fast food only. Don't take it. Dates, fresh dates are the fruits. Dry fruits are not fruits. Boiled banana is not a fruit. Fresh banana, fresh fruits only is a fruit. Fruits are the juice and whole fruits are not. And the major component of each meal has to be made of vegetables and some fruits. Fruits should not be taken in excess. And eating through eyes, ears and skin, that is basically education. Primary school, primary teaching, primary school should be the best ones. In fact, primary school teachers should be the most important people in a given society. This is happening in Scandinavian countries. The most respected people in the society is primary school teachers. Because they are the people who shape the future. So they are the most important people in the society. But unfortunately, bank udyogastha കിട്ടാതെ വരുമ്പോഴാണ് primary school teacher ആവുന്നത്. It has to change. We should have the most important, most talented, capable, dedicated, educated missionaries going to primary schools. That will change everything. Because we need to teach them. And they will learn about all these things and basics will be set there. Then people should be taught about good lifestyle. That has to start in the primary schools. I'm just giving a brief overview of the basics of individual health and social health. And the details, if you ask, we can discuss also. What is good lifestyle? It has to be taught in schools and colleges. It has started in primary schools. And to teach others after the primary education, we need large number of trained, educated, motivated primary care doctors. Do we have primary care doctors in India? Yeah. This is another pitfall of our health system. Drinking water we don't have primary care doctors. Primary care doctor, that England, out of the 170 doctors from India, only 2 could become primary care doctors in England because majority of their doctors wanted to become primary care doctors in their country. Their doctors prefer to become primary care doctors because that is most respected, most paid also, and most needed also. We don't need too many cardiologists, nephrologists and neurologists. We don't need too many indigenous people also. What we need is trained, educated, dedicated, motivated primary care doctors practicing medicine scientifically in the community, not in hospitals. That is family doctors. In some countries they are called family doctors, in other countries they are called GPs. All of them are same. Primary care doctors, GPs, family doctors, all are same. We don't have them. They are required to teach lifestyle to everyone after the primary education. Even in primary education, there is something called school health program. They will be involved in that to educate children on lifestyle. So what is good lifestyle? Most important is eating balanced diet every time that we eat. Second is proper waste disposal habits. People should know where to deposit each type of waste, how to segregate at origin and where to deposit. Third is ensuring safety of drinking water. കിട്ടുന്ന വെള്ളം സേഫ് ആണെന്ന് എൻഷുർ ചെയ്യുന്ന പേഴ്സണൽ ഉത്തരവാദിത്വം ഉണ്ട് നമുക്ക്. And need for physical exercise. They should know from these teachings. and no to certain unwanted things like alcohol, smoking, and plans for avoiding, protecting from accidents and injuries. Because think before you act principle. Whenever we do something, we need to think before a moment at least to avoid getting into an accident. Good posture at work, sleep and travel. How many people know how to sit? Actually, we should maintain maximum height when you are sitting. Except in but if you continue to sit in for long times in the bent posture, you are going to have problems in cervical and lumbar spines. Pillow but people use thick pillows, sometimes two pillows while sleeping, and you are damaging your cervical spine. And if you are sitting always like this while using mobile phones and computers, you are producing problem at the two levels, cervical and lumbar spine. While lifting a weight, never bend your back and lift a weight. Bend your knees and lift a weight, so that weight will fall on the thigh only. Cervical spondylosis, lumbar spondylosis, disc prolapse. And to avoid disc prolapse, the most important nutrient, one of the most important nutrients is water. Because 80% of each disc is cushioning in between two vertebrae. That has 80% water. If it is dehydrated, it will prolapse very fast. So water intake is extremely important after adequate air. Air and water are the most important nutrients. So good posture at work, sleep and travel. Hygiene, personal hygiene, sleep hygiene, respiratory hygiene. Respiratory hygiene is mask. That's not respiratory hygiene. Mask is respiratory hygiene. Most important is, before you touch your nose, wash your hands. You may be having allergens for allergic people, or it may contain formal transmission organisms may be there in your hand. So it's better that you wash your hands before you touch your nose. That's most important respiratory hygiene. Second is to keep a distance of at least 1 or 1.5 meters from others when you are coughing, sneezing. Or when you cough and sneeze due to a respiratory infection, never allow that secretions to be propelled into the atmosphere. How will you do that? You can use your elbows. Sneeze, cough, you can use your elbows. That is the best thing. So avoid doing that. Mask to be frank, mask will not protect you from getting disease. When you have a disease, you can probably do it temporarily to prevent others getting it from you. Mask it is not going to help you because you have to remove it sometime at least. The respiratory transmitter organisms will be there all around. So mask alone is not going to help you. Anyway, respiratory hygiene, sleep hygiene, personal hygiene. Personal hygiene everybody knows in Kerala. Before eating you have to wash your hands. But before going to bed you have to brush your teeth. That's the most important thing. Not early morning important brushing before going to bed. Gender empowerment. We better to call gender empowerment rather than sex education. Every child should be knowing about or age and gender specific sex education or gender empowerment. Training has to be given through primary schools. Again, we need trained family doctors to give it scientifically. So gender empowerment is all about empowering a child of either sex to handle eventual problems. That is the way people get into a lot of problems that we see, gender abuse, rape, all these are happening because of gender empowerment. It has to happen, it has to be an organized program. Again, that needs a team leader, that is family doctors. There should be premarital counseling for every individual. There should be post-marital counseling for every couple. So all this should happen automatically as part of health system. And that will happen if you have trained family doctors. And good work culture, loving the job that you do. When you select a job, it's not for money. Look at lifestyle in there, because it is going to give you stress otherwise. You will never choose a job for the money alone. People who choose a job for money are going to be stressed. They will end up in depression. Even as a part of bloom where you are. Stress is there a life without stress? If there is no stress, life has no meaning. Every moment is stressful. You should know how to handle it. And that lesson has to be taught right from beginning, from primary school onwards. Again, you need doctors with interest in all these aspects, that is, general practitioners or family doctors. I'll just give you the important aspects of stress management. Don't run away from stress, don't get frozen, and don't fight against stress. But you need to manage stress. Stress has to be managed. You cannot have a life without stress. These are the tips for managing stress that will be useful for everyone. Enjoy what you are doing. Whatever you do it enjoyably. Choose what you enjoy doing. Time management is stress management. Do not procrastinate events and appointments. Avoid smoking, alcohol, and overeating. People are more stressed when you are overeating and become obese, because you become unable to manage your stress. Smoking and alcohol, it helps temporarily only to manage stress. After that, you will be overstressed. Balanced diet helps in managing stress. So all these are together. Adequate rest, adequate sleep, short nap sometimes. Sometimes some people get relief by taking a bath, watching movie, listening to music, meditation. Meditation actually did not be looked at in a religious manner. It can be made scientific by talking about mindfulness. Mindfulness practice. It's like meditation in the religious manner also will help. But you can teach everyone without any religious connections by saying mindfulness practice. And prayers are actually religions itself, or religions themselves are meant for helping you manage your stress. But do they do that now? I doubt. I don't think any religion is helping the followers to manage stress. They make you more stressed to keep getting fight between the religions. Physical exercise definitely helps in managing stress. So all these are required for managing stress, and all these together will decide individual health. And all these, if you want to get, the society has to be made aware of and empowered. Creating awareness is one aspect. Empowering the society for all these things is another aspect. Then only you can be healthy. But unfortunately, we only hear about the minute aspects of individual health only when people talk on healthcare. That has to change. After talking about the individual health, even if it is one aspect, it has to be society is healthy. You cannot maintain your health in your own body alone. So learn about social determinants of health. Health is decided by all these factors. Most importantly, I told you about the air and water. After that, after air and water, these are things, agriculture. Nasser may be knowing about, may be telling you about decentralized integrated farming. Decentralized integrated farming probably is the best practice that we should promote to get necessary items. Next, most important is good primary education. To instill humanness. Humanness is the most important quality to ensure health. Why? Because you must develop concern for the fellow beings. If you have no concern for the fellow beings, you cannot build a social society which is healthy. And that is instilled by good primary education. We need good primary education for that. And then we need family doctors. These three are the most important components of building a healthy society. Safe drinking water, good waste management, shelter for all, sanitation, good lifestyle habits. But all these are possible only when the corruption level is very low. In a corrupt society, we will never get it. Corruption is the most important issue, stopping all these. So all discussions on health just focused on minute aspects of individual health is not enough. Let us discuss holistic aspects of healthcare, even if it is individual health. Talking about one aspect is alright, but at the end, all of us should finally discuss about individual health in totality, and then how that is possible in a society. Without social health, individual health is not possible. This is what point you have to keep in mind. Dr. Raju told me about water. That water, if it has to be available, unless it is available to every house, it's not going to work out. And there are no shortcuts and quick fix remedies. That is another problem with India. Everyone is coming out with one capsule and say that this will make you sexual energy, one capsule. The appetite, another capsule. There is nothing like that. Health is the ultimate product of all these together. And you are responsible now because society is not empowered for it. I would say you are responsible for your health because our society is not empowered properly. Otherwise, if the society is empowered, you will get it. That's what happens in Scandinavian countries. They will get everything without even being aware of. That is the kind of society that we need to build. We have lost science somewhere. Science is not talking about complicated issues. Science is scientific thinking, consent for fellow beings, common sense, applying common sense. Science. Science is something not using technology alone. So this is what I am trying to tell. Health cannot be achieved and maintained in compartments, either in an individual or in the society. Or indirectly, social health nurtures individual health. So let us all work for social health issues. That's what I thought about the cycle paths, footpaths, playgrounds, and safe drinking water, and proper diet. If everyone gets all these, we will have a healthy society. So public health or social health is science and art of preventing disease, promoting health, ensuring happiness and wellness in the society through organized community efforts. Wellness, happiness, you know probably where India stands in health and wellness. Very low. Probably among 150 countries, we are among, I think it is 130 of them. Very, very poor. Even countries with poor resources, I am telling Sri Lanka and Pakistan are ahead of us. Then people say, we only gave money for Sri Lanka. But whatever is available, if it is utilized properly, will improve it. The distribution of wealth and human resources is more important than the total amount of wealth. Is that clear? India is actually the richest country now. Don't think India will be healthier unless the money and human resources are properly utilized. You can never be healthy. The health indices published in the poem. Sri Lanka and Pakistan were shown ahead of us. Somebody said because of bias towards India. It is not. The utilization of resources is not proper. That was the reason. In the scientific facts are never take it personally, individually, or religion-wise. That is scientific science. Seeing messages and information in an impartial manner is science. That's what we need. What is said is more important than who said it. That attitude is lost in India now. Public health is nothing but social health. It is about making available health needs and the social determinants of health to all citizens, irrespective of caste, color, or creed. Can you maintain health in one religion alone, one place alone? It's not possible. So let us look after everyone equally, and the whole country as a unit. I would say even whole world as a single unit, and that's what. And India has been neglecting all this over the last 7 decades. Nothing has changed. Don't think in the last 14 years it has changed. Nothing has changed. It is the same, and we have built a country with maximum disease burden. Because we are now concerned about social health. I am criticizing it because I know what is happening in healthcare. When we were students at Calicut Medical College, we had only 5 medical colleges. Medical college, is there any medical college without patients? Doctor number has increased from 30, 100, at least 100 times. But no doctor is unemployed, no hospital is we are without patients. So what has happened is patient number has increased. So we have not done anything to control the burden, disease burden. That's where the focus should be on us individuals and responsible individuals. I'll just tell you, just I will show you the priorities in healthcare. Malnutrition is the number one priority. All of us have malnutrition, none of us eat a balanced diet. Well-nourished emaciated malnourished. If his body weight is appropriate, an emaciated person may be healthier than you. So it is those who eat a balanced diet and maintaining a normal body weight. Normal for every individual varies. Normal. Some people who are very emaciated may be perfectly normal. Body mass index should not be measured with the society minimum and maximum. It has to be individualized. Even this person is malnourished. This is extreme malnutrition. Second is this. We do not have safe drinking water. That is why we have to use this bottled water. This bottled water has to go. Otherwise, tap water should be safe for drinking. And that is the second important thing. Third is our environment. Waste disposal habits has to change. Waste management has to improve. And we should provide sanitation facilities everywhere. Everyone should have. This was a picture from Calicut City some 10 years ago. Probably they would have changed it after this picture had come in the newspaper. And lack of shelter. People is staying in slums. If they are continuing to stay in slums, it is our health problem. Don't think it is their problem. So let us have that kind of feeling. And in the middle of all these inadequacies, there is another poison that is injected into our mind: consumerism, unchecked consumerism. You are made to eat things beyond your capabilities or beyond your requirements because of the influence of film stars and cricket stars whom you worship. Look at these two. The wife, who is a film star, is telling, "I am proud of you," to the cricket star, because she was gifted with a costly diamond on her birthday. What is that? Why is that advertisement? Because they want to sell more diamonds. The diamond merchant may be giving this advertisement. And you are poisoned by these kind of advertisements by people whom you worship. Like Boost is the secret of my energy. That cricket star would not have seen Boost. He would not be drinking Boost. So that kind of advertisement has to be stopped. So let us stop these film stars and cricket stars from giving wrong messages using their influence on the public. This is what has happened with unchecked consumerism. People have gone back to the original shape. Besides that, put on weight also. The present state will be more than the last two pictures. Because on one side you have a problem with the cervical and lumbar spine, and you're assuming a posture like the original, and then put on weight also. And then these are the causes for all diseases. If you want to know the cause of disease, all these are given in this picture. Most importantly, malnutrition, which is the result of marginalization, lack of empowerment, lack of access, lack of awareness. Then all these problems which we discussed. And in India, we have a situation of malnutrition and consumerism going on simultaneously without being checked. In other countries, at least the undernutrition part is controlled, and safe drinking water, everything is controlled, and they have a low disease burden. We have all of them still remaining uncontrolled, and we have ended up as a country with maximum basic health issues, and we are number one in all diseases. Can you name any disease where we are number two? You cannot. That's where we are. So this is a very, very dangerous situation. This is what we have to address. It is not possible to control this by building more medical colleges or the traditional practitioners alone. We have to focus on social health. The focus is only on traditional practice and ultimate modern medicine practices. That's not what we want. What we want is social health. So nobody said, that's why I said in the beginning, social health is a neglected orphan in India. Everyone is neglecting it. Is there any Irish people talking about social health issues? Is there any modern medicine doctor talking about social health issues? Both are neglecting it. So this is what has happened in India. We are neglected social health unknowingly or knowingly, and the result is we have ended up as a country with maximum disease burden. I'm not criticizing anyone individually or any system of medicine. So you cannot find any disease that where we are number 2 now. In spite of all these, you will find that corporate hospitals are increasing, slums are increasing, mental illness is increasing, suicides, blindness. Remember that diseases occur among the marginalized people. Marginalization need not be in terms of poverty alone. If you do not know why a disease developed, you are marginalized because you didn't know, you are not taught. Suppose you develop diabetes and you didn't know why it developed. Then you are marginalized. Somebody should have taught you this is the way to prevent it. Nobody has taught it. So if you get a disease, that lack of information alone itself is a marginalization. And hospitals, if they are made, should be for the marginalized people. Why? Because diseases are more among the marginalized people. There's no point building hospitals for the rich people alone. In India now what is happening is building hospitals only for the rich people. This is the culture of America. America is a worst failed countries in the world. They have everything, but they don't have anything. 5 crores of people will not get anything there. Their situation is worse than our poorest people. 5 crores of people without insurance will not get any kind of treatment in USA. They go to Cuba for their treatment. Because so let us not imitate USA in healthcare. But in healthcare, India should copy Scandinavian countries, not USA. This is one message we have to try and tell all the responsible people. These are health problems across the globe. I have talked on this in several places. Malnutrition, starvation, it is not there in the developed countries. Poor environment, poor waste management, it is not there in the developed countries. Unsafe drinking water, it is not there in the developed countries. We only have it. And the last thing is there everywhere. Excess food, wrong lifestyle and unchecked consumers. But we have all the 4 simultaneously progressing, and we have built a country with the highest disease burden. This is the only health problem in the Western countries. Overeating, smoking, alcohol, unchecked consumerism, bad lifestyle. And then the question of health equity. Social health, we need to talk about health equity also. Equity means absence of avoidable, remediable, unfair differences among groups of people. The groups can be male, female, lower caste, upper caste, region, rich, poor. So that consideration should not come. Transgender, everyone should be getting equal opportunities. Then only we can say there is health equity, because health is a fundamental human right. These are the issues and challenges. No universal insurance coverage. I hope you know what is universal insurance coverage. NHS in NHS, that's a model for all the developed countries, but they have refined it to their advantage. But in UK has not. UK is a model for all the developed countries, but UK has deteriorated a bit. But still, they have it at the base. NHS, National Health Services, and 10% of, I forgot, it is 10% of their income they have to pay to the government. Suppose you have no income, you don't give anything. If you have 1 crore, you will be given 10 lakhs. But all will get the same treatment. All are given free to every individual, equal status. And in the hospital, Prime Minister and the ordinary man will be in the same queue. Same queue without any discrimination. That's what we should aim at. Universal insurance coverage according to the income on the NHS model. We have to build a universal insurance coverage, not like America. America, unless you have insurance, you will not get any treatment. Only those with insurance will get treatment. Out-of-pocket expenditure should not be there, and private should not dominate government hospitals. Privatization promoted by the government is good for other areas, industry and all, but not for health system. Health system should be under government only. The privatization of the health system is going to damage India's health system, which is already damaged. But there is nobody to criticize the government. If you criticize, you are declared as anti-national. That is a problem with our system now. So we have built an inverted pyramid. Genuine healthcare is neglected. Genuine healthcare means what? Safe drinking water, balanced diet, good environment, exercise, and that will reduce the disease burden. It is totally neglected. Then what is neglected is primary care doctors. We don't have any. Even general hospitals are neglected, but we have specialty hospitals. Equity in disease care is possible only when everyone gets the same opportunities for treatment of their diseases. So some of the way forward I have suggested, let us reduce the disease burden as a priority. We have to reduce the disease burden to sustain disease care systems. If the disease burden is very high, എത്ര ഹോസ്പിറ്റൽ ഉണ്ടാക്കിയാലും നിൽക്കാൻ പോകുന്നില്ല. ഇവിടെ നാട്ടിൽ മുഴുവൻ മെഡിക്കൽ കോളേജ് ഉണ്ടാക്കിയാലും you cannot sustain it. It will collapse. So let us reduce the disease burden as a priority. അതിങ്ങനെ ഓരോ ഇൻഡിവിജ്വലൈസ്ഡ് പറഞ്ഞിട്ട് കാര്യമില്ല. Let us focus on the social. Let us all focus on the social health issues. So provide all health needs to everyone. That's why I told about the social determinants of health. And provide good waste management, proper waste disposal habits. Because wellness or happiness is an issue of social security and human development. Another government criticizes because when we are told as 140, 132 among the 150 countries, there's no point saying that they are deliberately picturing India in a bad manner. And health or wellness should not be reduced to medicines or treatment. I told you about the importance of family doctors in health and wellness. We have to bring them back to India, otherwise we are going to deteriorate further. All of us should be fighting for bringing family doctors and GP doctors back to India. Till 40, 50 years ago, all doctors were working as family doctors. On the specialization level. So all were working as family doctors. Even without training, our MBBS joined work family doctor. And they continued to work as good family doctors and they were doing wonderful job. Because they do specialization, cardiologist, neurologist, അവർക്ക് ജനങ്ങളുടെ ഇടയിൽ കൂടുതൽ അംഗീകാരം കിട്ടി, കൂടുതൽ ശമ്പളം കിട്ടാൻ തുടങ്ങുന്നു, ഗവൺമെന്റും അവരെ പ്രൊമോട്ട് ചെയ്യാൻ തുടങ്ങി. ഫൈനലി എല്ലാവരും കാർഡിയോളജിസ്റ്റും ന്യൂറോളജിസ്റ്റും നെഫ്രോളജിസ്റ്റും ഒക്കെ ആയി പോയി. ഇപ്പൊ there are no GPs in India. This is where we are now. So we have to bring them back. Because 90% of illnesses can be solved in the periphery. ഒരിക്കലും ഹോസ്പിറ്റലിൽ പോകേണ്ട ആവശ്യമില്ല. ഫസ്റ്റ് ഓഫ് ഓൾ we have to reduce the disease burden. അതിനകത്ത് അവർ കോൺട്രിബ്യൂട്ട് ചെയ്യും. ഡിസീസ് വന്നാലും 90% you can manage in the periphery. 10% only need to go to hospital. Actually ഹോസ്പിറ്റലിന്റെ എണ്ണം കുറയ്ക്കാറുണ്ട്. പിന്നെ നെക്സ്റ്റ് ഇമ്പോർട്ടൻറ്റ് ഈസ് ഹോസ്പിറ്റലിസ്റ്റ് എന്ന് പറഞ്ഞ ഒരു ഗ്രൂപ്പാണ്. MD മെഡിസിൻ, പീഡിയാട്രിക്സ്, ഗൈനക്കോ, സർജറി, ഓർത്തോ, ഹോസ്പിറ്റലിൽ വർക്ക് ചെയ്യുന്ന ജനറലിസ്റ്റ് ഡോക്ടേഴ്സ്. And all doctors in India should have family medicine orientation, general practice orientation also. അല്ലെങ്കിൽ ഒന്നും വർക്ക് ചെയ്യാൻ പോകുന്നില്ല. So the medical curriculum has to be modified. ഇവിടെ പാലിയേറ്റീവ് കെയർ ഇങ്ങനെ വളരുന്ന കാണുന്നുണ്ടാവില്ല. പാലിയേറ്റീവ് കെയർ ഇങ്ങനെ ഹിറ്റായതിന് കാരണം എന്താ? Again there are no family doctors. ജനങ്ങളോട് നല്ല വാക്ക് പറയുന്ന ഡോക്ടർമാരില്ലാണ്ടായി. So there is a specialty, palliative care. എല്ലാത്തിനും സ്പെഷ്യാലിറ്റി ഉണ്ടാക്കാനാണ് നമ്മുടെ കൾച്ചർ. ജനങ്ങളോട് നല്ല വാക്ക് പറയാൻ വേണ്ടി ഒരു സ്പെഷ്യാലിറ്റി ഉണ്ടാക്കി. We should have majority of doctors talking like that, doing palliative care along with the patient care. That is family doctor, GPs. Family palliative care volunteers in the പറയാറുണ്ട്, അവരെ ഗൈഡ് ചെയ്യാൻ നല്ല ഡോക്ടർമാരില്ല. So what we need is family doctors even for promoting palliative care in India. Palliative care cannot grow independently without trained family doctors. Family doctors എണ്ണം കൂട്ടാൻ വേണ്ടി ഒരുപാട് സ്റ്റെപ്സ് ഉണ്ട്, which I am not discussing in this crowd. So priority should be to get primary care back in India. ഇനി ഉള്ളത് കുറച്ചുകൂടി സോഷ്യൽ ആസ്പെക്ട്സിന്റെ അതിന്റെ എക്കണോമിക് ആസ്പെക്ട്, ഹെൽത്ത് ഇക്കണോമിക്സ്, അത് പറഞ്ഞ ആവശ്യമാണ് എല്ലാവരും ഉറങ്ങി തുടങ്ങിയിട്ടുണ്ട്. സോ ഐ തിങ്ക് ഐ വിൽ സ്റ്റോപ്പ് ഹിയർ. ഹെൽത്ത് എക്കണോമിക്സ് എന്ന് പറഞ്ഞ് ഞങ്ങൾ ഓർമ്മിപ്പിക്കുന്നില്ല. ഇനി ക്വസ്റ്റ്യൻസ് രണ്ടാളുടെ കൂടി അയക്കുന്നുണ്ട്. കുറച്ചുപേർക്ക് പഠിത്തിലുണ്ടാവും.